Tragic twist. Rare bat virus claims life in Australia. What you must understand. July 3rd, 2025, 10:12 a.m. EDT, CBS AFP. Health officials scramble as uncommon rabies-like death occurs. In a devastating incident reported Thursday, an Australian man has succumbed to an extremely rare rabies-like infection caused by a bite from a contaminated bat. This health crisis highlights the persistent risks associated with uncommon infections in Australia, particularly due to Australian bat lyssavirus ABL. The victim, a man in his 50s, was bitten several months ago by a bat harbouring the virus, according to a statement from New South Wales Health Service. Unfortunately, Australian bat lyssavirus is not only rare, but also lacks a known effective treatment. The unseen danger, the vital facts. Kira Glasgow, an influential health protection director at NSW Health, emphasised in her statement that while instances of Australian bat lyssavirus are rare, there is no known cure for those infected. Remarkably, 118 individuals required medical attention following bat encounters in 2024, but this unfortunate case marks the first confirmation of the virus in New South Wales and the fourth case overall in Australia. The patient, from northern New South Wales and whose identity remains undisclosed, was in critical condition at a hospital this week following the bite. Health authorities have been investigating to determine if other potential exposures or influencing factors contributed to his severe condition. How it all unfolds, recognizing the symptoms. The risk of Australian bat lyssavirus stems from its way of transmission through bat saliva penetrating the human body via a bite or scratch. Though the onset of symptoms can vary from a few days to several years, early symptoms typically mimic flu-like conditions, manifesting as headaches, fevers, and fatigue. As the disease progresses, symptoms worsen rapidly, leading to paralysis, delirium, convulsions, and ultimately death. It's essential to note that until now, Australian bat lyssavirus has only been documented in 3 fatal human cases since its discovery in 1996, all of which resulted in death. Key advice: stay safe around bats. Notably, in Australia, encountering a bat should be avoided as any bat can potentially carry the virus. Only professionals trained in wildlife handling who have taken necessary precautions and vaccinations should be the sole to care with these creatures. Should someone be bitten or scratched by a bat, prompt first aid is crucial. Immediately clean the wound thoroughly with soap and water for 15 minutes, apply an antiseptic with antiviral properties, then immediately seek treatment with rabies immunoglobulins and a rabies vaccine. Understanding the transmission. This specific virus is primarily detected in certain types of bats, such as flying foxes and insectivora microbats, though the exact species involved in the latest fatal occurrence remains unidentified. James Gilkison, an expert in infectious diseases from the University of Melbourne, underscores the heightened risks. The virus closely resembles rabies, posing severe life-threatening consequences for those lacking access to timely treatment. A global perspective on similar incidents. To provide further context, last year at least 3 individuals in North America lost their lives due to rabies contracted from bat interactions. Tragically, in the US, a teacher in California died after a bat bite during a classroom situation. Similarly, Canadian health officials reported a child rabies-related death following a bat exposure in their sleeping area. Engage and share your thoughts. These incidents not only underline the vital importance of immediate medical responses to bat bites, but also spark broader conversations about wildlife conservation and public health education. What steps should be taken to prevent such rare but life-threatening diseases? Could your thoughts on wildlife vaccination and safe human-animal interactions save lives or offer new insights? Share your views and join the discussion.